If you've been told you need a deep cleaning, here's what that actually means. There's a difference between a regular cleaning, known as a prophy, or a deep cleaning, known as scale and root cleaning. You see, a regular cleaning, it's intended for people who have already healthy gums. The gums have a light pink color, the pocket of the gum line is shallow, and the gums fit tight against the teeth. Versus whenever you need scale and root cleaning, that means your gums are in a diseased state. The pocket depths are much deeper. The gums may look red, may feel irritated, may feel tender. They're inflamed. They bleed easily when you brush, when you floss. And oftentimes, patients will talk about having a bad odor in their mouth. And even some patients have pus that comes out from the gum line, or they're starting to have bone loss and loose teeth. So there's a big difference between a gum that is in a state of health versus a person's gums who are in a state of disease. And so we want to make sure that we diagnose you properly so we can provide you with the absolute best treatment. I'm about to tell you the exact measurement we use to determine if you need a regular cleaning or a deep cleaning, so it's not a guessing game. You see, dentistry is an evidence based science, which means we've got to see the evidence of what's going on before we can make a diagnosis. Once a diagnosis is made, then we can provide you with treatment solutions. And so, when it comes to the gums, we use a periodontal probe that measures the little pockets of the gum line. In a healthy situation, those pockets are 1 to 3 millimeters. No bleeding, no tenderness, versus when someone has gum disease known as periodontitis, those pocket depths can be much deeper. They can be 4, 5, 6, 7. Some patients 8, 9, 10. There can be pus that comes out from the pockets, and the teeth can feel loose. The looseness is due to the amount of bone that's around the teeth. You see, gum disease causes the destruction of bone. Bone is so important because it holds our teeth in our mouth. It's the supporting structure of the tooth. And if you lose bone, the ultimate fate is you will eventually lose teeth. Everyone asks me, will a deep cleaning hurt? Well, here's the honest answer. The experience of a deep cleaning can be different from person to person, but here at Colon Gentry Dentistry, we do our best to make sure you are comfortable throughout your entire procedure. Our hygienists are super gentle, although very thorough, and they're going to do a perfect job and get your gums back to the ultimate level of health. Now, then, to help aid in your comfort, oftentimes we'll use a topical anesthetic. It's like a jelly that we paint on the gum line. It penetrates through, it numbs the gums to allow us to give you the deep cleaning you need. Still, yet there are some patients that are a little more tender, a little more sensitive. And if that happens to be you, we've got you covered. We're going to give you a little bit of local anesthetic. Yes, that's a shot. We're very gentle the way we give it. Ultimately, when the local anesthetic absorbs in, you'll be super numb. You won't feel a thing when we provide the right treatment for you to get you back to the level of health that you really desire to be. The good news is you don't have to go back to deep cleanings forever. Here's how to get back to a more normal state of health. You see, when a person has gum disease, it's ranked on a scale from early gum disease to late phase of gum disease. And if we catch you early, if the gums are simply inflamed and there has been no destruction to the bone, no tissue damage, then ultimately we can get you back into a different state of cleanings. We would provide initially a deep cleaning, not a scale and recleaning. That is a treatment to help reverse what's going on in the disease progress in order to shift it back to a more normal state of health. And then once you're brushing and flossing and use a water pick at home, when you come to see us, we will do periodontal maintenance visits. The periodontal maintenance visits is intended to help you keep your gums in a more normal state of health. I see patients make the same mistake over and over again when they're told they need a deep clean, and it always costs them more in the end. And here's why. Whenever we diagnose a person with gum disease, especially if it's early, if we treat them right, then we can get their gums back to a normal, healthier state. However, the mistake that patients make is they decide to ignore the problem. They let a year, 2 years, 3 years roll by, and then they progress from being a early stage of gum disease to more moderate or some even late. What that means is the gum disease is now starting to affect the bone support of their teeth. As they lose bone, it becomes more and more challenging and difficult to get them back to a healthier state. As they lose more bone, eventually they lose teeth, and that's the end fate of gum disease. And that's how it can cost them so much more in the end because you don't realize how valuable teeth are until you've lost them. If you've had gum disease in the past, you're probably wondering, will I be getting deep cleanings for the rest of my life? Well, here's the answer. Not necessarily. While active gum disease, called periodontitis, is a chronic condition, and it cannot ever be cured, it can be managed. You will need specialized cleanings in the beginning called scale and root planing. But after this specialized cleaning, then as long as you're progressing towards a state of health, you'll only need periodontal maintenance visits. Those maintenance visits help us and help you to keep your gums healthy, optimally the best that they can be.